Then I will explain the laser stimulating the skin and the SWF to promote rejuvenation. Laser resurfacing equipment has continued to develop. I also upgraded to equipment used for Trinity rejuvenation according to the development. Early treatment rejuvenation used ultrapulse CO2 fractional laser. As you all know, the ultrapulse anchor is the most powerful CO2 fractional laser developed to treat war-wounded soldiers. Trinity rejuvenation has been upgraded to utilize the robust rejuvenation performance of the picosecond laser. LROB, the effect that creates an optical breakdown in the dermis while sparing the epidermis, resulting in the lesion due to cavitation and plasma explosion. LROB effect enables scar and facial rejuvenation treatment using a pico-fractional laser. I aim to target all the layers for facial rejuvenation. I have devised the so-called layered stacking method that combined the cavitation effect and the plasma formation.
I think that the highest power is a higher power system has a much more wider the reliable energy ranges, and it's quite important some practical ranges. But we are using very limited the practically necessary maximum power. So when you are using the just only for the rejuvenation in the popular dermal rejuvenation, there is no necessary the maximum power. But in certain kind of indication, we have this higher power as a key elements. For example, severe thick scar treatment with the debulking in the laser assisted delivery, definitely we need more power. But for the fluences, the power is divided the energy by time, and the fluence is energy divided by area. So in ablative lasers, shorter pulse duration has less char and it has low the complication rate. And
so this consensus was published by a group of scar experts around the world in 2019. There are three main ideas conveyed in this consensus. First is that laser is now the gold standard for scar treatment. And second, treatment should be initiated as soon as possible and best at the time of stitches removal. And third, low density treatment rather than excessive ablation on the lesion is now the main idea. So can we use this consensus and apply it to acne scar? And I think that we can, because we can treat it once all the wounds has healed, and that is almost similar like after the stitches has removed. So most of my clinical work revolves around treating acne scars in Taiwan. So I thought it was a pretty interesting idea, and I put it to a test. So
basically in photoaging, I mean, you know that there is a histopathological and clinical effect of chronic exposure to UV radiation, and it manifests as fine and coarse rhytids, xerosis, roughness, loss of tone, irregular pigmentation, and telangiectasia. Now, in radiofrequency and skin rejuvenation, and this is from a paper published in 2022, a lot of studies and trials were compared, and it was seen that the most used radiofrequency was fractional RF, which is also the device that I prefer, followed by non-ablative radiofrequency fractional. However, the consensus was that there is a large discrepancy in relation to the types and parameters. So for example, whether to use insulated needles or non-insulated needles, the different energy and depth parameters. It was varying for different studies, but there was one parameter which was not showing divergence, that was temperature. And it was seen that the maximum result in terms of the thermal damage that achieved neocollagenosis was between 38 degrees to 44 degrees centigrade.
Yeah. My opinion about the fractional laser is different, and in the market, the patient don't want to the persistent erythema. Right. Some doctors use the very high energy to make the persistent erythema, and then in the beginning. But as Dr. Haley Chan said, with a small treatment, small percentage treatment with a low intensity, with those kinds of treatments can, if we continue, even though the fractional, the non-ablative fractional laser also, I think the progress is going on. But the trend is also changing, like Dr. Gu said. And nowadays, the trend is moved to the kind of the materials to help to make a booster effect on the reduce the pores and reduce the scars. And then Dr.